Hello, everyone. It's been a little while. I thought I'd give you an update on my knee. As most of you know, I had a total knee replacement. It's been a little over a month ago. I've been dealing with really horrible pain issues and some instability, and I'm not happy with the staff at the surgeon's office. I'm really not happy with them at all. It's a real pain to try to get my pain medication from them every week. I've asked to talk to patient advocates 3 or 4 times now, and every time they refuse to let me, and they punch me into the doctors or the RNs again, even though I've told them before I don't want to talk to the clinical staff. I want to actually make a complaint about the clinical staff. So this place here that I'm dealing with, which I'm not going to name right now because I'm not trying to bad talk anyone, but I would not have a knee replacement done through them. I probably after all this is over, I will name them because people need to know. But I'm not happy with them. Anyway, an update. I'm still in a tremendous amount of pain, but I want to say I'm maybe 5% better pain wise than I was last week, which I know isn't much, but every bit counts. I'm still on the same amount of medication as I was before, 20 milligrams of oxycodone every 4 to 6 hours. I've been stretching it to about every 5 hours just because they're late with my medication every dang few days, which is all they prescribe me at a time. And every time they're late. The last time I had to wait till it was 10 after 5. The pharmacy closes at 5:30. I had been out of medication since that morning, and I was frickin' dying. And finally, they got it through. They stress me out with it every week. That's a whole video in its own self. But I've also been going to physical therapy, and physical therapy wise, I'm doing really good. My knee is supposed to be at a 120-degree angle. 120-degree bend is my final goal with physical rehab, and I'm actually at 113 already. So I'm a little ahead of the curve. So as far as that goes, I'm very happy with that, and so is my physical therapist. I need to work on being able to lay down and straighten my leg out completely, but I'm very close to that too. I've been up and walking a lot more. I'm actually to the point where I don't use the walker at all. I'm supposed to be using a cane, but honestly, I do more without it than I do with it. My knee still buckles on me a few times a day. Luckily, it's never taken me down to the ground or anything like that. Not yet, thankfully. But I'm actually to the point where I've been walking my dog about Gypsy about 2 blocks at a time now, which is way more than what I was able to do up till this week. Me and her used to take a walk every morning down to the river and through Old Town and back, and which was about we walked probably 2 miles a day at that point. So this is definitely baby steps to try to get back to that point for her sake and mine, and to where I can do a lot more and to where I can get back to actually doing something productive. But anyway, that's my update. I feel a little more positive this week, and I'm hanging in there. So anyway, please take care of yourselves, because if you don't take care of yourselves, you can't help anyone else, and you can't be no good for anyone else, and that's the truth. Self-care is very important. I have depression and anxiety issues. I'm bipolar, so I have to do a lot of that, or it causes issues for everybody else, because it gets tiring dealing with somebody that has anxiety and depression all the time. So I try to keep myself well balanced for those around me, and I try my best at it. And all of us have issues, and all of us have to do our best to do self-care. Take downtime. If you're feeling stressed, take some downtime. Put on a record, put on a cassette or CD, put on one of your favorite movies or a YouTube video that you're interested in, and just chill out. Take some you time. Take a walk. Do something. Get out and go see a friend. Anyway, and also take care of each other, because we're all we got, and this is an ugly world right now. Take care of those around you. All of us are equal in this world, and that's what we should strive for, is peace and equality. And if you don't believe in that, then you definitely have some issues to work on yourself. And I hope whatever trauma you're dealing with that makes you harbor ill feelings towards others. You can work through, because this world needs you to be a good person. Your family needs you to be a good person, and everyone around you does too. And if they're not good people, you need to be there for them to help guide them in the right way and help them work through their traumas and stuff too. So take care of yourself, take care of each other. Thank you very much for tuning in, guys. See you super soon.